Risk factors for breast cancer. Risk factor: age increase, early menarche, late menopause, nulliparity, obesity, peripheral conversion of fat aromatase to estrogen, alcohol, smoking, family history, maternal and paternal. Hormonal replacement therapy, maternal age at first live birth, greater than 30 years. DuPont's page classification. Histological categories: non-proliferative lesions, cyst, mild hyperplasia of usual type, columnar cell damage, change, no risk, proliferative lesion without atypia, sclerosing adenosine, moderate of florid ductal hyperplasia, radical scar, intraductal papilloma, fibroadenoma. Atypical hyperplasia, atypical ductal hyperplasia, atypical lobular hyperplasia, carcinoma in situ. Breast condition associated with increased risk in smoker: breast cancer, duct ectasia, Mondo's disease. Protective factor against breast cancer: maternal age at first live birth less than 20 years, breastfeeding greater than is equals to 1 year. Low dose OCPs do not increase risk of breast cancer. Breast cancer gene associated: breast cancer 10% familial, 90% sporadic. Main cause gene associated in breast cancer: P53, familial breast cancer BRCA, ERPR positive breast cancer PIK3CA, triple negative breast cancer. Hereditary breast, chromosome BRCA1, BRCA2, aggregation 17q, 13q. Aggregation increases, aggregation decreases, chromosome CR 17q, 13q. Main cause subtype basal, luminal. Risk of breast and ovarian cancer: BRCA1 greater than BRCA2, pancreatic, prostate, male breast cancer BRCA2 greater than BRCA1, colorectal and peritoneal cancer BRCA1 is equals to BRCA2. Indication for BRCA testing for all patients with breast cancer. Lifestyle modification in BRCA mutation: weight reduction, exercise regularly, smoking and alcohol consumption, MRI breast screening from 25 years of age. Risk reduction strategies: first is bilateral prophylactic mastectomy, bilateral salpingo-oophorectomy, tamoxifen SERM. Investigation: biopsy, 10 coronidal biopsy. Types: ductal carcinoma in situ, invasive, lobar carcinoma. Histological types: breast cancer, invasive ductal carcinoma NOS, Special types tubular, mucinous, medullary. Immunohistochemistry ER/PR nuclear receptor, HERS2 new membranous marker, grade 0/1 negative, 2 equivocal, fish fluorescent in situ hybridization, not amplified, not amplified negative, amplified positive. Third is positive. Molecular classification of breast cancer: luminal A, luminal B, HER2 enriched, basal like chlorin low type, basal like classical triple negative, most aggressive, worst prognosis, age young, high rate of mets. TNM staging: T tumor size, N lymph node status, M distant mets, CTNM clinical, PTNM pathological, RTNM recurrent, MTNM multiple tumor. 8th AJCC classification: T1 less than is equals to 2 cm, T2 2 to 5 cm, T3 greater than 5 cm, T4C, T4A involvement of chest wall, serratus anterior ribs, intercostal muscles, T4B involvement of skin, ulceration, direct infiltration, and body orange, T4D inflammatory cancer, anoregional node metastasis, N1 palpable mobile ipsilateral axial node, N2 fixed ipsilateral axial node, N2B presence of internal mammary lymph node, N3A ipsilateral infraclavicular, N3B internal mammary plus axillary lymph node, N3C ipsilateral supraclavicular lymph node, MO no distant mets, M1 distant mets. Important points: pectoral muscles involvement not considered in T4A, dimpling and retraction not considered in T4B, positron emission tomography, computed tomography, T12 10 minutes. Exception: PET-CT is not sensitive for brain. Prostate specific membrane antigen PET, positron emission tomography.